Good afternoon, everyone. My name is Adam Del Molino, and I am the Senior Director of Virtual Care and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Breaking Barriers, Transforming Patient Care Through Innovative Assistance Programs. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2024 sponsors for their support in underwriting today's webinar, which is just one of many events we have throughout the year to connect our members with leading experts in addressing timely issues like the one today. I'm pleased to introduce our presenter for today's webinar, Brianne Muchmore. Brianne is the Senior Director of Care Management at Spalding Rehabilitation Hospital and Spalding Hospital, Cambridge, and has worked there since 2013. In this role, Brianne oversees the inpatient and outpatient case management and social work departments at both locations. In addition, Brianne manages complex case management and has developed an innovative donor-funded patient assistance program, Supportive Surroundings, providing financial aid and short-term temporary housing. Brianne is a licensed independent clinical social worker and certified case manager. In 2020, Brianne managed case management teams at Boston Hope, the 500-bed field hospital located at the Boston Convention and Exhibition Center for patients with COVID-19 and post-acute care needs. Brianne is a board member for the American Case Management Association, Massachusetts chapter, and the co-chair of the Education Committee. Thank you all for being here today. Brianne, I'd like to hand it over to you.
Thank you so much, Adam. I'm so excited to be here today. So thank you guys for the opportunity. I'm just going to pull up my slides. Just give me one moment, please. All right. So thank you again so much for the opportunity to present about such an exciting program. I am pleased. Oh, do slides look okay?
Can you just go into the display settings and make that one change? There you go. You're all set.
One second. This is always the hardest part of these presentations, even though we did a test run.
I know. Okay, you're good.
But I am not seeing them on the right side. Just one moment. Adam, how does that look?
I can still see your notes, unfortunately. I think you still have to go back into display settings again.
Okay. Well, all right. We will do it this way. So no.
There you go.
Okay. Sorry, you guys. Technical difficulties here. But again, thank you so much for the opportunity. I'm really excited to talk about this program that we've developed. For those of you that may not be familiar with Spalding, we have 4 different buildings. We have 2 inpatient rehab facilities, an LTAC, and a skilled nursing facility, and we're affiliated with Mass General Brigham Health System. So today I'm going to talk about an innovative program that we developed, as Adam said, titled Supportive Surroundings. Some objectives that we're going to cover today. I'm hoping by the end of this presentation that you can identify 2 objectives of a donor-funded patient assistance program, apply 1 to 2 innovative practices that you can use within your respective organizations, and summarize 1 to 2 positive outcomes resulting from the implementation of this program through the case studies that we'll share today. So first, I'm going to talk about what is supportive surroundings. So supportive surroundings has 2 components. One, we have a financial assistance program that we can help patients address discharge barriers. So I've always encouraged my team, and I think any of my team members would say that, I always challenge them to think outside of the box, think creatively. How can we address those barriers? So much of what we do in case management is thinking creatively and innovatively. So we developed this program to assist with that. The second portion is short-term housing for patients and families. So we're going to talk all today about how we developed this program, how we got the funding for this program, and what this program entails. In addition, we get to share some fun case studies about the impact it's had on patients and families' lives as they transition out of Spalding. So as you all know, working in the healthcare system, there are a lot of challenges. Our clinicians identified that we really needed this program to support the ever-changing climate in healthcare. In the midst of COVID, there were limited skilled nursing facility beds. We got through the COVID times, but still had transition challenges. We learned that more and more patients had psychosocial issues that were keeping patients stuck in the hospital, but we still had the pressures to continue to decrease hospital length of stay and increase the throughput. We found that families, weren't necessarily able to afford accommodations in the Boston area or didn't have access to these accommodations. So this is where the need for this program began. We were so grateful that a former Spalding patient by the name of Jamie Bemis, she was a stroke survivor and was so impacted by the work that she did at Spalding and made a full recovery that she wanted to give back to the Spalding community. So we pitched the idea of supportive surroundings, and she helped us to develop this incredible program that we're talking about today. In addition, we partnered with the city of Boston, to identify accessible units that we could be able to utilize for patients and families as they transition out of the hospital. So I'm going to talk a little bit about our patient assistance fund. So as Adam said, I'm the director of both Spalding Boston and Spalding Cambridge. And when I got to Cambridge, it's an LTAC. So patients are really medically complex. But in addition to the medical complexities, there are natural barriers to discharge related to social issues. So I started looking individually at patients, and we had a patient that was, in the LTAC for almost 2 years. Given how complex he was, there was really no skilled nursing facility that could care for this patient. Family was interested and willing to take him home. So we started to do the training, but the only barrier that we had was a ramp. The family could not afford a ramp. We helped them with the home modification loan program to make other modifications to their home, but really couldn't get over that barrier of a ramp. So we decided to utilize the Supportive Surroundings Fund to purchase a ramp for this patient. It was a big purchase. It was $10,000, but as we know, the cost of being in a hospital is great. So just 2.5 days of the patient being in the hospital was paid for through this ramp. So it was a really big impact that we were able to make purchasing this ramp. In addition, we have purchased durable medical equipment. As you know, there's challenges with motor vehicle accident insurance. Obtaining equipment in a timely manner, we found that it was beginning to delay discharge. So we have a closet of different equipment that we're able to give patients and families, or we'll order directly from Amazon to make sure that that doesn't delay their discharge. Bathroom equipment is not covered by insurance. So sometimes patients aren't able to afford that, and we're able to purchase the bathroom equipment for them. Transportation is a big one as well. We found, as we all know, with the transportation challenges within the state of Massachusetts, it's difficult to secure transportation for discharge. So we partnered with Uber Health, and they, will often provide transportation home for our patients and paid for by the Supportive Surroundings Fund. In addition, we found that patients and families were challenged with getting to Spalding, whether it was paying for parking or the challenges with gas prices. So we've been able to pay for families to come to Spalding for training, because that's so important. In order to get them home, we need family involvement. So we'll pay for an Uber for them or provide gas vouchers for them to get here. Another big item is clothing. Most of these patients have suffered an catastrophic injury or illness that wasn't expected. So they're in the hospital and may not have access to the clothing that is needed. So for example, footwear comes up often. As you can imagine, a rehabilitation facility, footwear is so important for safety and fall reduction. So we have a clothing closet that we keep up to ensure that patients have the appropriate clothing. Medications. We have a coordinator that's able to assist in picking up medications and paying for copays when patients aren't able to access the medications. And in addition, gift cards. Sometimes we're seeing that there's food insecurities, and we've set patients up with the resources in the community, whether it's a community servings program or Meals on Wheels, and connected them with community programs. But in the interim, able to give them gift cards to help to purchase groceries. Another innovative thing that, recently we had a patient that was planning to go to a skilled nursing facility, and the patient was resistant to skilled nursing. And so, as we do, trying to help support and problem solve with them, try to understand what the reason was that was holding them back from going to the skilled nursing facility. And the biggest thing was the location. They were worried that their family members wouldn't be able to visit them enough in the program, and we know how important that is. So we purchased that patient an iPad and which allowed them to have access to FaceTime family members. And that was the hurdle that got them to accept the skilled nursing facility bed. So again, and I'll say this often throughout the presentation, really thinking creatively outside of the box. I very infrequently say no to our team, because I think it's important to explore all options for our patients, especially when we're trying to work on increasing throughput and managing our length of stay. So this patient assistance fund has been very, very effective. We have a very easy referral form that any clinician in the hospital, from physician to therapist, social worker, can fill out this form. Typically most items are under $100 or so, and the items will be purchased by our supportive surroundings coordinator and delivered directly to the patient's room. At times, if they're bigger purchase, like I said, like the ramp, we will pull together the supportive surroundings work group and talk about that decision if it's in the best interest to make those big financial decisions. Okay. So now, there's nothing better than hearing directly from a patient and family, and I wanted to allow you to see what these apartments look like. So I'm going to share a quick video, and I hope you enjoy it. This patient is Jake and his family, and you'll get a glimpse into the apartments that we have created for our patients. Supportive Surroundings is a donor-funded program that provides lodging and resources to our patients and families at Spalding. We have a lodging component where we can offer accessible housing that's close to the hospital and allows patients and families to really focus on their rehabilitation.
My name is Mike Tebow. Our son Jake suffered a spinal cord injury during a hockey game, and after a week of being in ICU, he was transferred to Spalding Rehabilitation Hospital. We are in an apartment offered by Spalding in a building called the Rope Walk. To know that we can be at Spalding within 5 minutes to address any of his needs just gives us as parents a sense of calm.
The transition of being able to have him come live with us here before we go home, I think has been huge.
Now that I have moved into the apartment here, I can continue this battle in a place that's comfortable, homey.
It's been just
great to have enough space to be as normal as we can as a family. Jake has plenty of room with his wheelchair to move around in here. We're able to have enough space to have some rehab equipment. There's plenty of space to just kind of live our lives while we're still doing rehab.
I can roll under the sink, I can roll under the stove. As far as features go, it's just how accessible it is and how easy it is to navigate right now. It really helps.
Being on the first floor, it's very accessible. There's only a couple of very minor thresholds that Jake has to navigate. He can get in and out of the apartment no problem. The doors are light enough that he can open himself.
Jake is able to answer the door with the security system. He also can use the stove. He can use the sinks. Everything is within his reach. The kitchen itself is fully equipped. The refrigerator, the shelves are lower in it, so he can actually see in, reach in, get what he wants. The oven is a wall oven where you can come from the side. The bathroom is very big, which is nice because he can bring his chair in, navigate through the bathroom. He's got the sink, like the kitchen sink, he can roll right up underneath it. And then the shower is a roll-in shower. So he's able to roll himself into the shower, use the attachments. He can turn it all on and off by himself.
As you heard from Jake and his family, this supportive surroundings program has been so meaningful to them. The support from our donors is absolutely incredible, and this program would not be possible without the support from them. We currently have 3 fully accessible apartments at the Roadblock building in Charlestown. We've been able to touch so many patients and families, and will continue to do so, and hope to grow this program with the support from our donors.
We were blessed to have this offered to us. It was a game changer for us. It really was.
It's definitely been an absolute blessing to have this. They've just been so welcoming and accommodating, and it's just amazing.
What Spaulding has offered our family is unbelievable. Just from giving us this roof over our head for us to be close by, I'm so grateful for it.
I hope that video was helpful to give an overview of the supportive surroundings program. It's so great to be able to see it through the eyes of patients and families, because that's, the heart of the work that we do. And every time I watch that video and, think about Jake and his family, it certainly touches me that we've been able to create a program that can be so impactful for Jake and other patients. So we'll continue to talk about how we built this program. While we are, it was a big project. It's certainly a big process. I think people hear how exciting it is and want to create this program. And I didn't realize all the work that went into it, like being a landlord at the same time. But we moved into our first apartment at the Rope Walk in 2021. And the video said we have 3, but since the video, we now have 4 fully accessible ADA compliant apartments, all in the Rope Walk building right here in Charlestown. It was a lot of work to build this program. I think, in the beginning, it was just me, and I would be running in and out and changing the sheets and doing the laundry. And thankfully, we were able to hire an amazing coordinator who does all that work now and, ensures that the bills are paid on time and that if there's any maintenance issues, that those are addressed. We've developed relationships with cleaning companies that consistently ensure that the apartments are ready for that next patient, and laundry services. Through this process, we developed relationships with furniture companies, several that were kind enough to donate furniture or give discounts to be able to furnish these apartments. We've tried to make the apartments as comfortable for patients and their families as possible, and as easy for them as they're transitioning during this difficult time of their life. So there's a welcome book similar to what you'd find in a hotel or an Airbnb that talks about the local area and talks about the Wi-Fi password and all those important items that they need to know when they're in this apartment. They, in addition, we have a guest book. So as you can see, patients are able to share their experience and what this program has meant to them in the guest book and learn about other people's stories as well. Our coordinator, Donna, has put together a custom welcome basket for each patient, which has a card and just some basic necessities for them as they transition into the apartment, which has been really appreciated as they're settling away from the home away from home. We have cable and Wi-Fi, Netflix. We've purchased different board games because, in rehab, we're always trying to focus on cognition and memory and those types of things. So different games that patients are able to engage with their family or friends while they're in the apartment. And then they have access to, outpatient. And we'll talk more about the outpatient program that we created, but we call it a bridge program, which includes case management and also custom outpatient programs. So we'll talk more about that later in the presentation. So these are just pictures of the apartment. I know you got to see one of the units in Jake's video, but you can see that everything is fully accessible and a great transition for patients as they're learning to do these things that were so easy for them prior to their injury, but are different when, as a wheelchair user. So rolling up to the stove, just the open concept and access to the kitchen so they can continue to do things and learn those things as they prepare to transition home. And I should mention that this program is short-term. And I'll talk more about our referral process, but it is a short-term program. So typically patients are there for about 4 to 6 weeks. Depending on their diagnosis and their plan. Another picture of one of the apartments, the pull-out couch. It's a 1-bedroom apartment, but the pull-out couch for caregivers. Many of our patients are spinal cord injured, and they do require caregivers, whether it's hired or family. So we have the pull-out couch that's there for them. An accessible bed. We have this bed. We are able to move in and out. Some of our patients require hospital beds, so this bed is easy transfer to get in and out. We also have bed rails that we can put on depending on the patient's mobility. As you can see, the bed is lower, so for wheelchair users, it's easy for transfer. Because the apartments are so close to our hospital, we're fortunate to be able to, if we have a patient, we're trialing different equipment, we'll be able to go over there with therapy during their therapy session and practice getting in and out of bed, getting on and off the toilet, those things that they're doing with their therapist in the hospital. You can see the bathroom. Which is a game changer. So few bathrooms, especially in the Boston area, are accessible. So being able to have the roll-in shower and the ability for the handheld shower head, and the grab bars already built in is really helpful for them. So we're going to talk about some cases and I'll give you some examples, but I really want to highlight how this program has impacted and aligned with our hospital goals. So we have improved our length of stay. Our length of stay decreased from 21 days in fiscal year 22 to 17 days in fiscal year 23, which is, as for those of you working in hospitals, that's a very significant decrease in length of stay. It's not only to this program, it's a lot of other initiatives that we've done, but this has really helped with length of stay improvement. You'll see with some of our case studies. It's increased our discharge to the community rate and, therefore decreasing our skilled nursing facility discharges. So at this point, we've been able to decrease the skilled nursing facility discharges by 5%. With a goal to continue to do so as we expand this program and add additional apartments. More frequently, patients are able to continue the enhanced outpatient program and then transition directly back to their homes. Throughput challenges. We hear every day, whether you're working in the hospitals and hearing it yourself, so you're hearing it on the news, the challenges with throughput. And being that we, as an IRF, a rehab facility, and an LTAC at Spalding, we're a big feeder for all the local Boston hospitals. And patients were getting stuck. A lot of it because of inaccessibility in patients' homes. So this has really assisted, and our teams do a great job at identifying patients early on that could benefit from this program, and making that referral so we are able to be ahead of it and not and proactive as opposed to reactive with the discharge. Addresses discharge barriers. We've talked a lot about the different barriers that it's addressed. Another big hospital goal for us is diversity, equity, inclusion, and also at Spalding we focus a lot, given our role in rehab, on accessibility. So we are, of course, having this program has enhanced that, those goals, and we continue. You'll see some data later. We continue to strive to promote more diversity within this program as we start collecting more data. And then patient satisfaction, of course, and you'll see throughout the presentation, and you heard from Jake and his family, like how happy they are and how pleased that they are after this traumatic event, that they're able to transition to a place that's comfortable while continuing their rehab. So now I'm going to break down, going back to the slide about all the impacts that it's had, and we'll talk about some specific cases. So you got to meet Jake, and Jake and his family are truly like near and dear to my heart. They were one of the first families in our first apartment in the rope walk. So it was very important to hear their feedback. And as the family said, they live far away, and to leave your 18-year-old son in the hospital and not be able to have close access to them is devastating. And so they were able to stay close to the apartment, or as close to the hospital, while Jake was in the hospital. In addition, in order to improve the length of stay, a lot of the work that we do is on family participation and family education and training. So having families so close to the hospital, Jake and his parents were able to be involved in his care from the very beginning. So they were involved, and they were understanding and helping and supporting. So it made for an easier transition home. Their home was not accessible, which is, the case of many of us. I'm sure if you think about your homes, there may be some of those barriers, especially in this Boston area. So often we get patients with spinal cord injuries that live in a third floor walk up. So they have to secure new housing, or, if they own a home, have to make significant home modifications. So this program has allowed Jake to stay in the apartment while they did those home modifications. Oftentimes patients get stuck, as we know, in hospitals or skilled nursing facilities, waiting for these home modifications to be completed. And then the outpatient program. So when you come to Spalding, you're getting therapy 7 days a week. You're getting 3 hours of therapy a day. It's an intensive program, and then you transition to outpatient. And the realities are that you may be going twice a week. So this program that we've created is custom. So it's looking at patients' needs and the assessment. But for someone like Jake, he benefited from coming to outpatient 5 days a week. So it's a more seamless transition as opposed to going down from 7 days to the 2 days a week. This is another case that was really unique. Most of the patients come from our Spalding Charlestown location, just given the patient diagnoses and given the location of the apartment. But this patient was a particular Cambridge patient. He was a young patient, and unfortunately was involved in an accident. It was hit by a car. As a pedestrian. He presented to us at Spalding, Cambridge. He had a tracheostomy, and he was in a minimally conscious state with this very, very severe brain injury. So he had a lot of medical needs, and it was devastating for his family going through this. He, in addition, had a history of major mental illness. So he was fortunate to, during his care at Spalding, he emerged from the minimally conscious state, but was still dependent, is going to need lifelong care. So we couldn't find a skilled nursing facility bed. At that point, I think we were at like 250 referrals throughout the state trying to find a skilled nursing facility for this patient. And upon discharge, eventually we, with support from the state, we found a bed for him. The family went and toured it, and as one can imagine, you know, it's a challenge. It was hard for them to envision their 25-year-old son living there at this skilled nursing facility. So they said, we're not discharging him to the skilled nursing facility. And so often in the field, we're met with resistance and, you know, trying to understand where this patient and where this family was coming from. And for them, seeing their 25-year-old go to this skilled nursing facility just wasn't an option. They were committed to caring for him, but had to figure out how. They had an inaccessible house with several flights of stairs, but they were fortunate to have resources to be able to purchase a home. So the patient transitioned to our apartment. We worked with a private duty home health agency that provided the 24/7 round the clock care that the patient required, and they stayed and lived in the apartment. And the family did everything possible. They sold their home and bought another home that was accessible. So he is now at home, you know, which is amazing to be able to be with his mom and his dad as they're caring for him in the community. Continues to come back to outpatient with a goal to continue to be as independent as possible, but knowing that this patient will likely need care for a long time. This apartment was critical for them. So it goes back to one of our hospital goals of improving discharge rate to the community rates, and of course decreasing skilled nursing facility. And this was a great example of a patient. This is another patient and named Becky, and of course everyone has given me permission to share their pictures and their stories. But I'll take a second to read Becky's quote. She said, "Supportive surroundings gave me the opportunity to continue my intense rehab from spinal fusion surgery to maximize my recovery potential. The apartment was an easy life transition from inpatient rehab and less daunting than going straight home to an inaccessible house. Just 3 blocks away from Spalding, I was able to get to my appointments with my power wheelchair in a safe and timely manner. I've also enjoyed having friends and family visit to explore the local Charlestown community." So Becky is a woman that, you know, had a disability at birth and has been a disability advocate, but was a new wheelchair user. And so she was used to advocating for herself and the disability community, but now was learning how to adapt in this power chair. So she is a great story about, you know, thinking about throughput, thinking about accessibility, and it continued to allow her access to rehab. She's still here local in Charlestown and with the goal to continue to improve and transition back home. Patient satisfaction, you know, I mean, it's evident throughout all these slides and stories that this has been really impactful for patients, but Chris really stood out to me because he had young children and he had recently gone through an amputation, had a leg amputation, and he was in so much pain and had so many infections previous to the amputation that he wasn't able to do the things that he wanted to do with his girls and with his kids. So he came to Spalding, participated in this program, transitioned to the apartment. And as he says, you know, therapy built my confidence in navigating this new reality. Preparing to transition home through the support of surrounding departments confirmed that confidence. So he has a goal. He wants to be a Paralympic athlete. But in the meantime, he's really excited to be able to be home with his girls and be able to do things he wasn't able to do before. Like run alongside his daughter with his daughter on her bike. The last story I'm going to share is a combination of the 2 programs. So this was a gentleman with a 75-year-old gentleman with a diagnosis of a stroke. He was working minimally in a local grocery store, but really had limited community supports at his house. He had a neighbor that checked in on him, but didn't have many friends or family in the area. He lived alone. He didn't have any options of where to transition to. And the only barrier to discharge was him being able to do 3 flights of stairs. So sending someone, to a skilled nursing facility, A, that wouldn't meet the criteria, but B, like wouldn't do service to him. So he stayed in the apartment for just 3 weeks, but continued to practice the stairs. That was the primary goal. So he actually had home care come to the house and continue to work with him on those stairs, and then transitioned back to his home independently. Because he was on a limited and fixed income, the assistance program was also able to purchase groceries for him, some medications, and some shower chair in that transition period for him. So that's a unique story of being able to use both the housing component and the assistance program. So just some data, which is really exciting that, so far since the beginning of the program, we have housed 78 patients and or their family members in the 4 apartments that we have. And those were a gradual build up to it. We started with 1 and increased. We have served 256 patients with just general assistance, as we talked about. So a total of 334 patients have been impacted. This family member reached out and really wanted to share. We have a small pediatric program at Spalding as well. So she says, when my son was discharged from Spalding, he was wheelchair bound. Since my house has stairs, we couldn't bring him home. We needed a temporary solution for a few months until he's back to walking. As we know, finding a wheelchair accessible apartment in Boston for a short lease is almost impossible, especially during the time when our attention is fully focused on his recovery. He can be active around the house, participate in various household activities from cooking to laundry, and easily get outside. So this program really, you'll see this patient comes back and visit the pediatric unit, and was able to have, he's a high school student, was able to have his friends over, play video games, and do some of the normal activities that he's missing out on, during his recovery. So I talked about the enhanced outpatient program, and so we have outpatient case management program that also supports the supportive surroundings patients in the apartments. So they help with, continued discharge planning, continued access to resources, whether it's applications from Mass Health, or home modification loan program, any of those case management needs, they're able to work with. Of course, having this program allows us a more seamless transition from inpatient to outpatient, because we often do co-treat. So the outpatient clinicians will come up to the inpatient floor, especially with a complex patient, and participate in the therapy. So it helps with that transition, and reduces the likelihood for readmission or falls, or any of those factors at home. So again, the outpatient program is custom to the patient's needs. So we look at we do go through insurance. We look at insurance benefits. We try to maximize what their insurance can offer based on the clinical recommendation. So patients, it's not a traditional outpatient. It's custom to their needs. They may receive more PT if they don't have as great of speech therapy needs. So initially, as you saw, our donor, Jamie, was a very satisfied former patient who made a recovery and wanted to give back. So that's how the foundation of this program started. But as you heard throughout the presentation, we aligned with all of our hospital goals related to length of stay and throughput. So we have started to collect more data, and we recently, I was excited, we were awarded a grant through the United Against Racism, and it's going to help us to have research folks look specifically at the data and help us to analyze, so we can continue to grow and build that program. One item that we really want to start looking at is like how many hospital days were saved by discharging these patients. So we're going back to to track that. We also created with the help of our lovely team, created a Tableau dashboard. So we have easy access to pulling some of the data. So this is just a quick screenshot of the Tableau dashboard, but you can see that it pulls very quickly how many patients were served in the apartment, how many were served through financial assistance. We're tracking race and ethnicity, tracking the services that they received, whether it was outpatient or home care or not applicable. The occupancy calendar, ensuring that we're maximizing. We almost always have a queue of patients that are ready for the apartments, but maximizing and turning over the apartments as quickly as possible. Tracking the diagnosis. So as you can see on the with this data, we have some work to do with our diversity. Right now, it's over 70% of the patients that have been in the apartment have been white. So we are collecting that to continue to diversify our program. And you can see that 50% of the patients, 50% of the patients are spinal cord injuries. And I think that's just the nature of the injury and accessibility. But followed by ortho patients, a lot of them that are non-weight bearing and unable to do stairs for some period of time, or amputations, and brain injury. So we're excited to see like what the future holds with this data, and I'm grateful for the team that's helped me to start collecting this so we can continue to grow, which leads me into future planning. So I tend to dream big, and I am so excited that we have 4 apartments, but I think we need 20 at least. So I'd love to buy a building and be able to do this because there's been so much value. Tracking and analyzing data, so partnering with our teams here at Spalding to ensure that we're staying on track, like we just talked about. Further resources to address the diversity, equity, inclusion, and accessibility. Ongoing partnership with donors, because I think that often, obviously, as this program grows, we're going to continue to need, donor support. So working closely with our amazing development team, and I spend a lot of time getting to talk to donors about the impact of this program. Developing relationships with community agencies for donations. I think that given the limited time, we haven't been able to do that as much as I envision. People hear about the program, they want to give and to donate. So hoping to improve upon those relationships. Even partnering with like local food banks and or restaurants that would donate gift cards or food when patients are in these apartments short term. And then of course the volunteer program would be great, because so often families or patients reach out and they want to be able to give back somehow. So again, like I'm going to continue to dream big with this program and hope that we can keep growing. So I'll close with, and then we'll take questions. So feel free to start writing questions in the chat, but I'll close with a quote from the family. "We were blessed to be able to live in this apartment as its first residence. This apartment became home while our son was inpatient for 2 months and then transitioned to outpatient for another 2 months. These walls heard many tears and frustrations, but they also heard laughter, support, love from family and friends who were able to stop by for a visit. These walls helped us to get back to a new normal." So I'll close on that note and open for any questions.
Brianne, thank you so much. This is an amazing program, and we really love the opportunity that it has provided to so many patients for short term and for them and their families as they continue their treatment and their care at your hospital. So thank you so much for this presentation today. I really appreciate it. As we get started and think about questions, I know folks will enter some questions into the chat. Just wanted to ask briefly, how did you get buy-in from stakeholders to establish and put this program together?
Yeah, that's a great question. And I do have to say thank you all so much for this opportunity, because this is a program that I'm so incredibly passionate about. And so I'm really excited to share the great work. But buy-in. So, I learned, like, we started with Jamie, who was our, grateful patient donor, and she just wanted to give back to patients. And then I started to think about, like every executive or leader in our hospital has different goals, right? So when I'm talking to our CFO and trying to get buy-in on about purchasing a ramp and saying like, $10,000, but how many days in the hospital? So really aligning with what those goals are, working with our Chief Learning Officer and identifying the goals related to diversity, equity, inclusion. So really relating to this program, because as you saw, there are so many impacts that it's had. And I'm sure that everyone in on this call today can think about how it would help your particular hospital or institution. So thankfully it's had relatively easy buy-in. I always offer tours for people if they want. I think our physicians at first were like, what is this program? Being able to offer them tours to come over, share pictures, share videos. But it has a great reputation now within Spalding. So thanks for that question.
Yeah, no problem. Questions are starting to come in through the chat, but I did want to ask you one additional question. We know that Mass Health has made application to CMS through the waiver process to be able to cover and reimburse for short-term post-hospitalization housing programs. Would you think that might be something that you use to support this program in the longer term? And also, would you seek additional support from other payers as well?
Yes, absolutely. If there's anyone from the payer world or the state on here, absolutely, we would love to partner with you. Right now we've had the only payer that we've worked with so far has been workers' comp, and obviously there's more flexibility there. But we have worked with workers' comp, created a contract with them, and provided that housing. But it would be amazing to be able to partner with the state and or any funding programs. I know that we're seeing that insurances are denying skilled nursing facilities more frequently, but there still isn't always a safe discharge plan, which then they end up staying here longer, or and causing some throughput challenges. So I would love to see that grow.
Awesome. All right. So the first question that I'll take out of the chat, Jennifer writes, would love to contact information for Brianne to talk through additional programs that can help with what we're talking about today. That was from Jen. So Brianne, if while we're sitting here right now, maybe you could enter your email or other contact information you want to share into the chat, so folks can find you and want to chat with you afterwards. The second question comes from Maureen, and she asks, who is eligible for these programs and what's the referral process?
Yeah, I'm glad you asked that. I realized I totally skipped over that. So when we developed this program, I did a lot of research. I met with programs like Ronald McDonald House to kind of determine how they, because we were building this program from scratch, so how they did it. And so we do a $25 a night donation if the patient or family is able to. So that's probably 50% of our patients are able to pay $25 a night or more, and the other 50% are not. So that's never a limiting factor, but we find more often than not, people really want to give, and sometimes they can only afford $100 for their entire stay, but are so grateful that they donate anyways. So anyone is eligible for the program. Really, the referral process is it's a form that, and then we sit and we meet, myself and the supportive surroundings coordinator, talk through the clinical. We have to make sure it's a safe, of course it's a safe plan. And then we do need to make sure that there is some sort of discharge planned at the end, because as you know, these are short-term housing. So we unfortunately aren't able to provide longer term for patients with housing insecurities or homelessness. Hopefully that answers that question.
Yeah, and there was a follow-up question as well that came in from Colleen, and she asked the question, is there any eligibility criteria that you use? It's really based on the patient's rehabilitation and social needs, or do you take into account their finances or income as well?
Yeah, we take into account finances and income, not really, but as far as their rehab and social needs, definitely those are the key factors. If a patient isn't able to, I think the first thing we look at is if the patient isn't able to discharge safely from this hospital, why, and could supportive surroundings help them? Or could a patient really benefit from more intensive custom outpatient program? A lot of times it's temporary, that they we saw a lot about home modification, so it's temporary while their home modifications are being complete. But really anyone is eligible. We look at all cases. We do try to identify a plan early on. So we meet with the patient and family and say we're anticipating that you're going to be in the apartment for 4 weeks, and outline what that will look like. Because naturally, just like there's challenges with discharging patients from a hospital, it's not all, perfect. There's also challenges with discharging patients from the apartments.
Awesome. So if folks have any additional questions, please feel free to enter them. My friend Barbara asks a question. She notes it's a great program. What's the size of the budget that you've worked with for this program? If you don't mind sharing a
Yeah.
little detail.
Yeah, we started, the initial pledge was $2.5 million to really start this program. And a lot of our donations, like, so that was the biggest donor. A lot of our donations are smaller donations now. So we're working with the development team to continue to grow. We grew fast, and almost like I joked about bringing laundry home to my house at one point, and like I store furniture at my house. Like it truly has become like a program that I'm so passionate love, but there's a lot of like work that goes into it. So we, as we continue to grow, we'll likely need a full-time coordinator to build this program. And then we'll look at increasing apartments. But even us as a hospital working with real estate, it's challenging to find accessible apartments in the area. So we're on the wait list for many different units to hopefully have the funding to continue to grow. Yeah.
And so going along with that question, when you started, kind of accessing these apartments,
Yeah.
what was the process like for you to make the modifications to make them accessible? And what was that process like?
Yeah, we were fortunate to start early on with the builder and really work and talk with the builder about what our wants and our needs were with this apartment. We've made some minor changes, but obviously like changing the whole kitchen structure is going to be challenging. But so we worked with the development. So ideally it would be a new development that apartment that you could work with from the beginning with the build. But some temporary modifications like grab bars or changing out the shower head have been doable as well.
Awesome. So thank you so much. Any further questions that folks want to enter into the chat? Anything that folks want to hear from Brianne or have any questions for her on? All right.
All right.
Being no further questions, thank you so much.
Yeah, and I put my email in the chat, so feel free to reach out to me if you want to come tour one of the apartments. I would welcome you, or if you're interested in starting a program at one of your buildings, I'd be happy to talk more about that. So I appreciate everyone.
All right. Thank you all so much. I know there's a lot in the presentation that folks will be taking back to their organizations. And as we are coming up on time, I want to thank Brianne once again for leading a great session today. And thank you all for joining us. As you can see here, please scan the QR code on your screen now to see all of MHA's educational programming, including our additional webinars in our Innovations in Care webinar series. We have several events planned for this spring, and we hope to see you again soon. Have a wonderful afternoon. Thank you.
Thank you.